All right. Good evening, everyone. Welcome to tonight's workshop for the Justice Reinvestment Equity Program. I am happy to turn it over to our facilitator for this evening, Crystal Watson of the Latino Coalition for Community Leadership.
Thank you so much, David. So today we're going to meet the Latino Coalition for Community Leadership. We are the contracted TA and capacity building organization with this project, as well as learn a little bit about me, your facilitator for tonight. Tonight we're discussing project plan design, and so we just kind of want to walk through how we set up these workshops for project plan and budget and administration. Go through the selection criteria, project plan questions, talking about types of human services programs and how your project model looks and your workflow and timeline for that. And then we'll open it up for questions. So the Latino Coalition for Community Leadership is the contracted TA and capacity building provider for the JREP project. With me tonight is March Runner, our Oregon State Director.
Welcome everybody to this workshop. I'm hoping you find it informative and have a lot of questions because we're ready to start working with everybody.
I'm in.
And so the Latino Coalition for Community Leadership was formed 20 years ago as a response to small grassroots nonprofit organizations not accessing federal and state grant funding. And really the question was why, right? Why, community organizations were doing great work, serving lots of people. They look like them, they worship like them, they are in the same communities that they're serving, but they were not accessing federal and state dollars or some of these larger grants, and so we're not really sustainable as an organization. And so as that response, the Latino Coalition for Community Leadership was formed, and we do not do direct service ourselves. What we do is we focus on the organizations that are working in community and really help to try to build their capacity and strengthen them for longer term sustainability. And so we have been contracted with the Northwest Health Foundation to provide capacity building, training, and technical assistance to the JREP grantees, with the goal of strengthening these organizations through the 27-month grant period. Sorry. And then a little bit about me. I have been with the Latino Coalition for Community Leadership for 10.5 years. But prior to that, I worked in nonprofit development. So doing grant writing myself. I do grant writing for the Latino Coalition now, but doing other types of resource development for organizations. And then I was in direct service for those organizations doing youth reentry. So that those were incarcerated youth, 11 to 17, coming out of longer term incarceration as youth, and helping with that reentry process and re-engaging back with their families, as well as working with gang intervention programs. And so the project plan and budget workshops that we've provided, we've done the same one earlier this week. You're hearing the same thing again. We also did a budget and administration workshop. Both of those will be on the Northwest Health Foundation's JREP website for you to access, as well as these slides. And they're really meant to be complementary. So when you're thinking about the budget, you're also kind of thinking about your project plan. And when we're walking through the project plan today, you'll hear me reference how this affects your budget. And so they really should be treated as complementary. Your grant funding amount is absolutely going to inform your project plan. How many people can you serve? What can you do with them, right? And your project plan is going to inform your budget. Where are resources needed in those different categories? So do not write both in a vacuum. Right? The best proposals will have both sections inform each other. So if you say in your project plan, you'll serve 1,000 participants, your budget needs to reflect that, right? With your staffing and with the participant related program support that you'll have. And the budget will also need to be reflective of the project plan that we're working on tonight. If you are responsible for both sections, you'll want to kind of jump between them as you write. So don't write one and then write the other. Go ahead and walk into kind of what your project plan you think you're going to do, then kind of dip into your budget and kind of get your categories, then go back to your project plan, think about, other types of things you might be doing, and then jump back to your budget. So it's really best to kind of do them at the same time, so you know that you're saying the same thing. And if you use other staff or volunteers for certain sections, say you're doing the writing, but your director of finance is doing the budget, you'll really want to coordinate as a team to make sure that you are saying the same thing, like the numbers speak the same thing as what your narrative is in your project plan. So Northwest Health Foundation has selection criteria for the JREP project. And so we just wanted to walk through that selection criteria with the project plan in mind. And so it is a shared commitment to JREP goals, a demonstrated experience working in communities that you're proposing to serve, clearly describe project goals and how proposed activities will meet those goals. Staff and board should reflect the community served, geographic equity, and an intersectional approach. And so on page 26 in the RFP guidance are 4 project plan questions, and that's really what we're going to be working through through this workshop. We'll look mostly at number 2, but we're really kind of looking at these 4. And so the first one is to describe the problems or issues you are addressing with this project and the specific services and activities you will use to address them. How does your project align with JREP's goals, right? And then the second question is about project plan and timeline. So to describe your plans for implementing the project. What is the timeline and who will be involved? And this question is so broad, right? It gives you like lots of room to do everything. And so we'll kind of talk through how to maybe think about that project plan and how to present it. The third question is your impact. And so what will success of this project look like? And please including specific examples of how this project will impact your community and the people you serve. And then there's a fourth question that's optional. And so is there anything else you want to tell us about your project or organization? And so going back to those 4 questions, the first one really is a statement of need, right? What are the problems addressed and how are you aligned with JREP? And so the question's really kind of asking why you, right? Why your organization, why your services, what's going on in your community that you are best posed to provide, and then also that alignment with JREP goals, right? So you're doing a statement of need, the problems addressed, but you really want to kind of answer that question of why you. Number 2, for project plan and timeline, you're thinking about all the stakeholders here. So what does this project do? How will participants experience the project? How will the community experience the project, right? And then describe how this project fits into your organization with that staffing, if it's complementary to other services you do, and how that kind of looks internally for you. The third question is really lovely and broad. I think Northwest Health Foundation was very generous in not deciding what impacts look like and not having these, standard measures in order to do it. And so they're really interested in what success looks like. And so for this question, you'll need to define that. You'll need to define that for the reviewers. And so what does success look like? So really it's asking, what are you measuring? And how do you know if you're done? Right? How do you know if the participant's done with you, doesn't need services anymore, exits your program? So what are you measuring and how do you know when you've gotten there, right? When there's success. And the fourth question is optional, but this is your chance to share what previous questions didn't ask. And so, I think the RFP does a really good job trying to ask questions to get the best sense of what the organization applying the best sense of who they are and what they do. But not all questions, right, really get at what you are. And so this optional question, don't waste it, right? Go ahead and answer here, and go ahead and say anything that you were not able to say in the previous questions. And so if I can just take a minute and kind of talk about human service programs as like a background whole. So this is not part of the RFP itself. I have out there that it is a CW list, a Crystal Watson list. This is just how I kind of think about programs in the human services field for nonprofits, but they also will have, budget considerations and program model considerations. And so my 4 categories are transactional, academy, life, and hybrid. And I'll go through what I mean by that. So transactional programs are needs-based, and participants will access the program when they need it, and they don't when they don't need it. And so examples of that could be like housing or a food bank or an employment job center, where people go in because they're looking for something, right? There's some sort of need. And then when that need is met, they don't come anymore. So they're not kind of hanging out. It's not a community kind of center. Like they're going in for something that they need. A food bank gives food. And then you don't go to the food bank when you don't need food, right? So it's very transactional. And transactional sometimes can seem like a bad word. That's not at all what I mean. And a lot of times for these transactional projects, they're much easier to budget for, because kind of based the need of your community about how long people access your services. And then there's a clear exit, right? When it's needs-based, once you've given them the service, once they've gotten a career or job training, they might not come back, right? And you're able to exit them. And so that makes it a little bit more easy on their budget side to kind of plan for things. The next category is academy. A participant applies or has an intake, and then it qualifies them, right, for services. And so you may have some sort of structure where there's an age range. And so if you only serve 16 to 24-year-olds, if you're 15, you can't enter the program. If you're 25, you can't enter the program. You could have like a K through 12 program that really is structured for people within that age range. You might also have some sort of structure or pathway. And so basically everyone that kind of goes through this program has access to the same kind of structure or pathway. And then there's like a graduation or an exit at the end. And so examples of this are, I say CBT based. What I mean by that is cognitive behavioral therapy, where, there's certain classes that you might need to take, but then there's like a certificate at the end, right? And you kind of graduate on. Youth build programs throughout the US are meant for, I think they're 16 to 24. And those are for youth to get their high school diploma or equivalency, and to also learn construction fields. And so they, bring participants in as cohorts and do some sort of training. And then once they get their GED or high school diploma and their credentials, they're kind of graduated out, or age-limited programs. And so academy, a lot of times could have it in a cohort model for enrollment, where a bunch of participants start at the beginning of the school year or the beginning of a calendar year. Or if you have housing that's available, right? Like people coming in for housing, staying for 90 days and kind of rotating off. And so you could kind of have more of a cohort model there, where they go through a pathway and then they're exited. The third type of program is life, and it could use a better name, but I just kind of call it life because the idea is that the program never ends, that there's not really an exit. And so there's always something that, kind of the philosophy there is there's always something more that the participant can do, right? You're kind of working on yourself internally, or you're exploring new things. And so some of our addiction programs are like this, right? Where the philosophy is like the addiction's never done. You'll always need some sort of support program. And so you can always access it, right? And the participant, like the program never really ends for you. So there's not really that exit or graduation like you would have in an academy model. Other examples are like a faith-based program. And so with that belief that the participant there's always more that they can do, participants tend to stick around, right? This type of program is really focused on building a community and really just trying, enrolling people and having them involved with the organization for years and years and years. The hard part with this type of program is because there's no exit, it's really hard to budget for, right? So you might be enrolling some people on day one, October 1st, that are still going to be with you and still need supports on month 27, right? And so when you're thinking about budgeting, and when you're thinking about if this is your type of program model, you'll really want kind of like a ramp up, right? Because you'll need more money in the last couple months of the project than you do when you're enrolling right at the beginning, right? Because participants tend to stick around and still gain services, right? Months and months or years later. And then finally, there's hybrid, right? So some projects or programs have a mix of two or more models. So you might have some things that are very transactional in nature. That's all you're able to do. And so that piece of the project becomes very transactional because the resources are finite, the time is finite. I've seen a lot of academy models try to keep their graduates or call them alumni and still kind of keep them on, and so they become more of a hybrid between academy and life to try to keep on those that they've graduated involved with their organization. And so finally, I just want to write of those 4 model types, when you're thinking about your own project and program and organization that you have, just to consider what your model could be, right? Between those 4 categories, or if you think about it somewhere else, and how does the participant experience your program? And also, what effect does your program model have on your budget? Because they'll really need to inform that. So below I've attached 2 different types of workflows. If you don't have something fancy like this, please do not worry. The one on the left was taken from the internet. The one on the right is one that we've used for our wages project. And so you do not need to have anything fancy like this for your application for JREP. What I just kind of wanted to show is a lot of times an organization will kind of map out how a participant experiences their program. And they do it in a visual way, right? Through one of these program model workflows or infographics. And so what that allows you to do is, if you do have this as an organization, take it and use this when you're writing about your program in question number 2, right? Because you can just kind of walk through and discuss all the different, how someone experiences this flow. And that makes it super easy to kind of describe your program. If you do not have one of these, I would say do not take the time to have to make it, right? That could be later, but we'll go through some questions that you can ask yourself as you're thinking about how participants experience your program. And so the program model workflow helps to answer question number 2, but you do not need anything fancy like this. Instead, it's just visualizing the flow of your program and jotting down those points. When writing, these points can then become your paragraphs, right, as you describe how your program works. And then again, think about who your project affects, right? So how does the participant experience the program services? How does the community experience your program? And how does your program fit into your entire organization services? What impact does this project have, right, on your staffing? And how does it enhance it, or how does it affect it? And so then I've broken up how a participant experiences into 3 parts, right? So entrance, middle, and exit. And so for the entrance, how does a participant enter the program? What do? Do they come off the street? Is there outreach or recruitment in the community? Is it word of mouth? Do you have a referral process? And that could be either informal or formal, but go ahead and name those partners, right? Here's the support we have in the community. Here's who refers. It's done like in a formal referral process, or it's just informal. These people call and say, do you have room? And we take them in, however that works. So how does a participant find your program? How do they enter into it? Also kind of think through, is priority given for any types of participants? So do you really prioritize a subset of the demographic of any types of participants? Is it open to everybody? There's no right answer here, right? You're just kind of describing your program. And so what if there's any priority that's given for who you serve? And then also go ahead and answer the reverse of that. So is there anyone you can't or won't serve? So maybe you do your classes at a Boys and Girls Club, and so you are not able to serve someone with sexual offenses on their record, right? Or maybe you are gender specific in your programming. And so go ahead and say what that looks like. But then also discuss, do you refer individuals to other programs? So if someone walks through your door and you're not able to serve them, what happens to them, right? Where do they go? And so go ahead and name partners there too, because I'm sure you have them. Also describe what intake looks like, right? Is it a 5-page form? Is there any type of assessment that goes along with it? Is it done at a certain period of the year? So how do you know who you serve? And are there any qualities with your participant entrance that makes your program unique? So it could be that you've really thought about it through a lens of like trauma informed or gender responsive or culturally specific. And so this is your chance to really kind of talk through the participant entrance into your program, but then also what makes your program really special, right? And really unique. So for the middle part, right, your services to those participants, what services do you provide? Also think about the program models. Does everyone follow the same pathway? Is it customized per person? Do they get to choose? Do you do assessment and then you decide what services they need? Or is it participant choice? And so really kind of walk through like what is offered and then how does someone get to choose it, or if there's a pathway, or what's kind of your philosophy behind all of those. What participant supports or incentives do you have? How long does it take, right? Are they with you for 2 years? Are they with you for 3 months? Is it a cohort model? And what I mean by cohort model is, groups, right? So are you enrolling youth into your program, and it's an after-school program that meets at the middle school? And so really you see your enrollment happen maybe at the beginning of the school year, and maybe some more kind of trickle in January, and then you do other types of things in the summer, right? Or is it rolling enrollment? So do you really just kind of, people walk through your door and based on your history, that you serve 5 people or 10 people, or right, you're enrolling a certain number of people each month into your program. Is there anything you measure during this part that reviewers should know? So what are you measuring? Do you have any feedback? How do you know what you're doing is working or not working, right? We haven't gotten to success yet, but is there anything that you measure during this part? And then are there any qualities that make your program unique? So again, that same kind of question for the entrance. I'm now asking it again for the services. So really kind of describing what makes your program unique, what makes your services unique, how are these aligned with JREP's goals? And finally, your exit. So again, think about program models. Do participants exit? Maybe they don't. What does it look like, right? Most programs will have participant exits that look like their definition of success. That's your question number 3. So whatever you've decided as your success, that's usually when programs will say, hooray, we did it together, and now you're off in the world, and that's kind of the exit. What does that look like for you? For participant exits that don't look like success, are there any structures or support to identify them? How do you track them? And so, maybe the case manager calls the participant twice. If they're not able to get a hold of them, then maybe they do go and do a home visit, right? Or do you have any type of those types of structures or supports to identify that a participant isn't in? How do you know that they haven't shown up in a while? So do you have attendance sheets? Do you have a database? Do you have anything where someone's looking kind of at those reports and saying like, hey, I haven't seen Joe in 3 weeks, what's going on? And so how do you identify those and track those? And then can and do participants come back if they need additional services? So do you need to then re-enroll them into your program and do a new intake? Do they just kind of come back when they want? And so your program may fluctuate throughout the months and years. What does that look like? And so again, for your entrance, your services, that middle part and your exit, really kind of give a sense for question number 2 about what your project looks like. So enrollment plans, not necessary to have, but necessary to understand for your program design and the budget implications. So we talked a little bit earlier about, cohort enrolling or rolling enrollment where people come each month. We've seen some places where, is it based off of reentry release, right, from facility? And so you're kind of, your program then is reliant on, a system, right, a facility to gain access to or to have someone come out of. The participant entrance, length and time, and exit is going to determine the number of participants you can serve with JREP. So if you serve people and for months and maybe even years, and you have the drop in year 2, you may still be serving participants that were enrolled in year 1. And so again, your year 1 budget may need to look different than your year 2 budget, because your year 2 budget, you may still be providing case management support or participant payments, supportive services, incentives, and year 2 when they were enrolled in year 1 as they're finally meeting their goals. And so then also too, in the budget workshop, we discuss staffing. Do you have certain ratios for staff to participants? You might have a certain, caseload that you allow, so a minimum of 40 active. That's just an example. You may have a ratio of youth to adults that you keep. And so what does that look like? And so then again, as you're thinking about staffing and budget under this grant, that then will determine how many participants you can serve in your program design and what that's going to look like for JREP. And so timeline considerations, just, kind of taking a step back for the entire grant period. Project grants are expected to be able to start quickly. The planning time is 1 to 3 months, right? And then implementation. And so the idea with the project grants is that there's, a shorter planning period, and then by month 4, they're enrolling participants. And so if you are applying for a project grant, you'll want to kind of think through your enrollment plan and your program design that has participant services month 4 through month 27. The capacity building project grants have a little bit more time for planning, right? So the capacity building project grants are meant for programs that could use a little bit more support in the beginning, and maybe some infrastructure in place as they set up hiring new staff or building out a database to track. Maybe you've never run payroll before, or have an accounting software. And so really kind of taking the time to set up with this project grant. The capacity building project grants have a planning period for 1 to 6 months. And so that could mean less time for services, right? Because you'd be looking to start enrolling participants after that time through month 27. And then what does the JREP grant period project ends look like for your enrollments? And so does time in your program kind of determine what success looks like for you? So if success looks like a 6-month mentoring relationship, then you need to kind of back into that as far as your project plan of that all participants should be enrolled by June 30th of 2025 to be able to have 6 months of mentoring before the grant period ends on December 31st, 2025. So when you really think about question number 3 of what success looks like, and you're defining that, that then is going to inform your enrollments, right, of what that can look like, because you'll need time to serve those participants and report on them for success before December 31st, 2025. So going back to page 26 in the RFP guidance, the statement of need, problems addressed, and alignment, that's that why you question, what makes your organization unique? How are you aligned with JREP goals? What's going on in your community? What problems are you addressing that make it really important to receive JREP funding? Number 2 is where we spent the most time today, and that is the project plan and timeline. What does this project do? How will participants experience the program? How will the community experience your project? And also describing how the project fits in your organization. Number 3, project impact and success. What are you measuring, and how do you know if you've gotten there, right? If you're done, how do you know what success looks like for you? And so really kind of walking through the reviewers for your application of what that looks like for your particular case. And then finally, optional, this is your chance to share more. And so please take the opportunity to do that. Okay, I will pause there for questions.
Crystal, we have one out of the chat. This is referring back to when you were discussing about sharing about partners that you do not serve as an organization or provider. What if you don't know organizations that serve the population you don't?
Yeah, that's a good question. So I think if someone walks through your door and you don't know where to send them, what are you doing with them, right? So kind of share that with the reviewers of like what happens there. And all of those questions that I had were just example ways to kind of talk about your program for that question number 2 project plan. So you actually don't need to answer this specific question, right, for it, but it does help. It does help to be able to recognize that, hey, we're not able to serve everyone. This is who we do serve. And this is who maybe we can't serve or we don't serve. And then hopefully maybe with JREP funding, you can do a community scan and you can find out more about what's going on in your community. And maybe you say, there's no one else that's serving, right? Maybe you've identified a big gap, but it's really good to kind of, it's like knowing what you know and knowing what you don't know, right? And so taking the time to kind of learn that about your community is great.
Thanks for that, Chris. And I'll add that we purposefully and thoughtfully did not insert into the application a request for letters of support or a list of the community partners any organization or provider are working with, because we didn't want folks to be in a position to have to create that out of nothing or have to go out and convince others to be named in their application. If that is something you want to share, we're more than happy to review it as our reviewers go through that. But we want you to present authentically what you are, who you are, what your organization is doing, and who you're serving. And if the response to that is that there's not other organizations that you're in contact with or communication that are serving folks that you don't, by all means, just either say it or don't say it, but we don't want folks to feel that they have to go out and force relationships just to try to present themselves, because again, it was something we intentionally did not insert into the application questions. I have another question from Lucia. Is the 325,000 cap per organization, or could the fiscal sponsor and the sponsor apply for that amount? And so, Lucia, I think if I'm hearing correctly, your question is, you have an organization that is fiscally sponsoring another organization or group, and both are interested in applying for the project grant with capacity building support at the $325,000 each. Is that allowable? And the answer to that is yes. If you're a fiscal sponsor and you're sponsoring an organization, you both can apply for the same type of grant fund. As we've said before, there's going to be a competitive nature in terms of the volume or the amount of grant applications that will be reviewed. But it doesn't change, it doesn't penalize one or the other. It's just the amount of grant applications that we're going to be considering. And that's all from the chat. Mute or ask a question, please feel free to do so.
So I had a question, Crystal, did you work at Homeboy Industries? No. So someone knows I'm from LA. Get this. I have worked with them, but I never worked for them. So we've partnered with them, but I have never, that Homeboy was never my employer. Paul, if you've seen me at a global Homeboy conference, I have been there. And yeah, so definitely my community, but not my employer.
This was another great presentation. You guys have done a great job of being very clear and concise. And I actually appreciated some of the overlap from the other meeting about making sure your budget matches your program and things like that. This is good.
All right, Crystal, I think if there's no questions, we can give folks back some time this evening.
Oh, wait, actually, I'm so sorry if people dropped off. We do have 3 more slides. Sorry, so just informational. Hold on. So these slides were part of the informational meeting that Northwest Health Foundation did, but I put them here just to do a whole reminder for people again. So applications are due Wednesday, July 12th by 5 p.m. Please do not wait until 2 days before to start your application. Go into the online Northwest Health Foundation's Giving Data portal to look at the application ahead of time. And you can save your work and kind of go through, and so you can take your time in there. Northwest Health Foundation strongly encourages consultation meetings. And so Cleo and David both have their Calendly links there. You're welcome to reach out to them. This is also on the Northwest Health Foundation website under the JREP project, and is also in the RFP guidance PDF. And so you'll be able to find their contact information, but they strongly encourage a consultation meeting before you apply. If you would prefer to submit your application in a language other than English, Or if the application portal is not accessible for you, please contact Quinn McNichol, the grant manager at Northwest Health Foundation, and they can absolutely help you in figuring out another way to submit, right? This shouldn't be a barrier. And so this evening was the last time for these workshops. We did 4. We will take the best 2, one of each, and Northwest Health Foundation will post it to their website. The slides will be provided, and you can access them at a later date. And then finally, key dates, again, July 12th, 5 p.m. Pacific time. Do not think it's midnight, it's 5 p.m. So get them in. July through September, there will be an application review and potential site visits. September 15th is when the award notifications will go out with an October 1st start date for that grant disbursement.
I have a question.
Of course.
Site visits. What if we don't have a site?
I can answer that for David, but he'll come off. They will meet you at a coffee shop.
Okay.
That is absolutely correct. Wherever we can, we will meet. If we have wheels, we are mobile, we will travel.
And bonus points if it's good food.
Oh, please, good food. Take us to a local spot. Yes, yes, we want some good food. Wherever we meet, I love good food. Ooh, yes, Medford coffee shops.
So David wrote to everyone in the chat that they're pretty filled up for June, so please get your consultation meeting booked sooner rather than later. And then we do have another question. So can funds only be applied to new enrollees, or can they be applied for individuals who we already have relationships with? So I think for the purposes of the JREP program, there will be some demographic information that you'll collect, right? Because you'll need to report that to Northwest Health Foundation. So just, small kind of demographic as far as maybe their age or where they live, and those types of things. So even if you already have a relationship, right, you'll still need to kind of collect that. And then there still are those outcomes measurements. And so however you can kind of measure what success looks like for them, that would be fine. David, do you have any more to add to that question?
Yeah, I think we are really looking at, this is an inaugural fun first time that this is happening in the state of Oregon. And so we're really looking at that project period from October 1st of 2023 through December 31st of 2025. So we're really looking at sort of that snapshot in time. And so folks that you're interacting within your project, whether you have a relationship or they're a new enrollee, it's going to be really focused on that period of time that we're looking at. So you can evaluate those folks into your metrics or your data or your reporting and your all the things that you're going to be sharing with us.
We have more time for more questions. No. So thank you everyone for attending. I hope this was informative, and best of luck to your proposal writing.
I actually just thought of something. So if we're not
Yeah.
selected, do you guys provide support on like how to like maybe find resources on like maybe accountants or legal assistants for the nonprofit support?
So I would say not for this particular RFP. The folks that are awarded will participate in one of the 2 grant opportunities. But I think there's a conversation we can probably have with you outside of the JREP program if you are not one of the awardees, on ways that we could potentially provide you with direction to resources. But I'd want to hear more about the kinds of resources that you're looking for. We know what we know and we don't know what we don't know. And if we can give you some guidance or some direction to folks that we know in the space, we would definitely do so.
Thank you.